Thank you. Just so everyone knows, I am an independent infection prevention consultant, and I'm hired by Metrex as their infection prevention advisor. So thanks for taking the time to join me today for You Think It's Funny, but it's Snot, infection prevention in schools. Some of the things we'll talk about are how organisms are transmitted in a school environment, the importance of a layered approach to infection prevention in schools, what a cleaning plan is and why it's important, and we'll look at cleaning methods and products used in schools. We're focused on grades K through 12. We're not going to include early care and education, although most of the same strategies apply and actually even more. Excuse me, ECE could be its own presentation. Maybe I can talk Metrex into doing a webinar on that another time. Soon schools will be out for winter break. There will be family gatherings with close contact, mostly indoors, sharing food, drink, kissing and hugging, all the things that make the holidays enjoyable. When school resumes, besides returning students and staff, there will probably also be some respiratory and GI illnesses that will accompany them. Protecting school spaces from illness is no easy task. It's a complex challenge requiring a science-based approach. So on May 17th, 2024, the CDC released consolidated evidence-based guidance for preventing the spread of infections in K through 12 schools. The CDC guidance includes everyday actions that schools can take to prevent and control the spread of things like respiratory and stomach viruses, influenza and norovirus, and bacterial illness like strep throat. The guidance is designed to maximize school attendance while also preventing the spread of infectious diseases because being in school provides many benefits, including ongoing learning and social and emotional development. The CDC strategies are based on research and expertise gained from decades of working to prevent disease transmission in school settings, along with what we learned, probably the hard way, from COVID-19. The Department of Education's infection control guidelines also align with CDC recommendations. They both outline practices schools should follow to prevent the spread of infectious diseases among students and staff. To better understand how to prevent organism transmissions, we need to understand the chain of infection. Microorganisms are part of everyday life and are found in our air, soil, and water. Many microorganisms also live on our bodies without causing harm, and some even help us stay healthy. There's only a small number that are known to cause infection. So how are microbes spread? There are many factors that can increase the risk of transmission of communicable diseases at school. Things like close contact to others, sharing of objects, inadequate personal hygiene supplies or how to use them, and students or staff who attend school while sick. According to the CDC, a minimum of 3 things are needed for an infection to occur. The first is a reservoir or source, which are places where microorganisms live. And that can be in a person carrying the microorganism, in bodily fluids like feces or discharges from the eyes, nose, or mouth, in the air, or on a surface. People are one source of microorganisms. They can pass microbes to others, even if they don't have symptoms of an infection. The environment is another source of microorganisms. In schools, desks, lunch tables, faucets and sinks, play items, or those shared instructional materials can be a place where organisms live. Next is a susceptible host, which is someone who is not immune or who has a weakened immune system. For an infection to occur, microbes must enter a susceptible person's body, invade tissues, and multiply. And the third is a mode of transmission, which is the way microorganisms infect a susceptible person and move around. Now, the types of infectious diseases commonly found in schools are the common cold, there's diarrheal illnesses, mononucleosis, strep throat, and influenza. Microbes depend on people, animals, the environment, or shared objects to move about. The spread of microorganisms can be prevented by adhering to evidence-based practices and having plans in place that can help reduce illness and illness-related absenteeism by preventing the spread of common infections. Now, that mode of transmission is particularly important because it describes how microorganisms are transmitted from one person or place to another. For contact transmission, we have direct and indirect. Direct contact occurs when a healthy person comes into direct physical contact with blood or bodily fluids from a sick person. Skin-to-skin contact, like holding or shaking hands, is a good example. Some organisms transmitted by direct contact are MRSA, HIV, chickenpox from the secretions, norovirus, and E. coli. So next is direct droplet, which refers to spray with relatively large but short-range aerosols, usually less than 3 feet, and they can land in the eyes or within the nose or mouth of a nearby person. Now, direct droplet is classified as direct because transmission is by direct spray over a few feet before the droplets fall to the ground, so close proximity is necessary. So think of sprays and splashes that can happen when an infected person coughs, sneezes, talks, or vomits, creating droplets, which can carry microbes short distances. And just an FYI for the curious, vomiting is a form of droplet transmission, but some evidence suggests that projectile vomiting can also aerosolize infectious particles and lead to airborne transmission. Now, examples of diseases spread through droplet transmission are the common cold, influenza, pertussis, and meningitis. Then we have indirect contact, and that's when pathogens are transferred between individuals by a contaminated intermediate person, an object, or an environmental surface. There is no direct person-to-person contact. So indirect includes airborne transmission that occurs when microbes are aerosolized in tiny particles that can be transmitted through the air over greater distances, and they hang in the air for a longer time. Now, these microbes can eventually be inhaled. Some diseases spread by airborne transmission are chickenpox, measles, TB, and COVID-19. Next are fomites, which are inanimate objects, environmental surfaces, or food and drink that can carry and spread disease and infectious agents. Surfaces that are touched frequently by different people carry the greatest risk. So think of door handles, tables, desks, restroom surfaces, eating and drinking utensils, writing utensils, and any shared electronic devices and toys. Fomite transmission is usually associated with transmission of respiratory and gastrointestinal disease. Some infections transmitted by fomites are RSV, rotavirus, norovirus, and C. diff. Next, we have vectors, which are living organisms like mosquitoes, ticks, and sandflies that transfer pathogenic microbes from their bite. Vector-borne diseases are transmitted from human to human or from an animal to a human through an arthropod, like a mosquito or tick. The organism must pass through that vector before it can infect humans. And examples of vector-borne illnesses are malaria, Zika, West Nile, and Lyme disease. So an easy way to remember how to break the chain of infection is direct transmission can be interrupted by preventing contact with the source, but indirect transmission requires different approaches, like the use of adequate ventilation, cleaning and surface disinfection, mosquito nets, and insect repellents. Close contact between students is a significant factor in spreading microbes across the school environment. The main modes of organism transmission in schools are contact transmission, both direct, example of that would be shaking and holding hands, and indirect by those fomites touching contaminated surfaces or people. There's also direct droplet transmission from those coughs, sneezes, talking, and singing, and airborne transmission, which is how chickenpox and measles is spread. Now, one thing we need to address is poop. Poop can spread organisms like Shigella, norovirus, and Salmonella, which all cause diarrhea. Poop can also spread respiratory infections like adenovirus and hand, foot, and mouth disease. School-age children that need diapers changed, help with toileting, or kids or staff that don't wash their hands adequately after toileting can spread infections via the fecal-oral route as both direct and indirect. So poop is considered direct contact when someone comes into direct contact with feces, and indirect contact when someone ingests contaminated food or water or touches contaminated objects or surfaces. Contact with animal poop, that classroom guinea pig, can also spread microorganisms if hands aren't washed. Now, some organisms can also be transmitted through blood. This type of transmission in school settings is rare, thank goodness, but always follow your facility's plan for blood exposures. Studies from the COVID-19 pandemic showed that robust, layered infection prevention and control measures can help schools operate to minimize the spread of infections, even during a pandemic. Our focus today is on everyday actions in a layered approach to infection prevention that can be taken to prevent and control the spread of infections in school. Now, these everyday actions include taking steps for cleaner air and better ventilation, cleaning, sanitizing, and disinfecting, performing hand hygiene, and respiratory hygiene, cough etiquette, and vaccination. Infection prevention and control in schools requires focus on each of these layers. For one layer to translate into improving safety, other layers must be put into practice as well. Now, James Reason's Swiss cheese model demonstrates the layered approach to infection prevention in schools. Think of it as lining up slices of Swiss cheese. Some slices have holes, allowing things to slip by. Other slices give protection. Each of these slices or layers helps to reduce your risk of getting and spreading infectious diseases, but there's no single slice that's 100% effective at preventing disease. That's why it's important to have many layers or slices for reducing your risk. Even if the protection isn't perfect, the more layers of protection you add, the lower your risk of getting and spreading infectious diseases. They work together. So let's look at these more closely. Microorganisms spread between people more readily indoors than outdoors. The fact that humans spend most of their time indoors and that indoor air is often more polluted than outdoor air has a considerable impact on human health and well-being. So when you really think about it, the first indoor space you spend most of your time in is your home. For the average American, the second is your place of work, unless you're remote. But for school-age kids and teenagers, that indoor space is school. Considering the many hours students, staff, and teachers spend in school buildings, a school's indoor environment and air quality should be a top consideration. School buildings often have high crowding indexes, and that's the number of people relative to the size of the confined space, and long exposure times, which can increase spread of infectious disease. Indoor ventilation practices can reduce microorganism concentrations and overall exposure, especially to viruses. The Environmental Protection Agency estimates about 46% of all public schools suffer poor indoor environmental quality, and 50% of schools self-report unhealthy indoor air quality. Some of the most common physical symptoms from indoor pollution exposure are coughing, shortness of breath, sneezing, wheezing, sinus congestion, eye, throat, and nose irritation. There's also headaches, allergic reactions, worsening asthma symptoms, or even asthma attacks, respiratory illnesses, fatigue, and nausea. Research has proven that harmful air quality also affects student attendance, comfort, and academic performance. Respiratory conditions and absenteeism rates share a close association. And this is really a significant concern because 1 in 13 school-age kids suffer from asthma, which can be easily exacerbated by poor air quality. Indoor comfort, think temperature and humidity levels, also plays a role in concentration and productivity, as well as academic success. A study surveyed high school students on exam day and found about a 12% higher likelihood of students failing an exam on a 90-degree day compared to a 75-degree day. Teachers and staff also experienced similar consequences, impacting job performance and productivity. And in one study, 80% of teachers cited facility conditions as a factor in their teaching quality. Some measures that can be taken to improve air quality are to ensure existing HVAC systems are providing the minimum outdoor air ventilation requirement in accordance with ventilation design codes. One of the roles of an HVAC system is to dilute and remove contaminated air. These systems exhaust a certain percentage of air from the building and replenish that same amount with fresh air. The amount of air exchanges per hour can also be increased for infection control purposes. You can also clean air through filtration. You can increase filtration of microbes by using a higher rated filter if your HVAC system can handle it. Using the highest minimum efficiency reporting value, that MERV rated filter, with a rating of 8 or higher for your ventilation system, will filter out more airborne microbes. You can use portable air cleaners or air purifiers in spaces with low ventilation. Both of these devices remove impurities, but an air cleaner only filters the air, while an air purifier actually sanitizes it, removing particles, including dander, dust, and dust mites. You can also open classroom and bus windows if it doesn't create a safety hazard and your policy allows it to increase ventilation. Having more windows open is helpful, but even just cracking a few windows open is better than keeping all windows closed. You can also use fans to increase the effectiveness of open windows to help draw outdoor air into classrooms and other spaces. And then some other things you can do is hold some activities outside, such as lunch, certain classes, or recess in social periods. Adequate ventilation and filter changes on ventilation systems can help break the chain of infection, particularly respiratory viruses, by providing fresh air, diluting the amount of infectious airborne microbes, and filtering some of them out. More information on air ventilation is listed in the resources section at the end of this presentation. School surfaces are reservoirs for microbes. Bacteria and viruses on contaminated objects or surfaces, those fomites, play a role in the spread of respiratory viruses. According to ABC News, surfaces and objects in a typical school are contaminated with up to 15,000 microbes. A study in the Journal of School Nursing showed that student desktops were one of the most virus-contaminated surfaces in the average school setting, with 5 out of 27 desktops contaminated with the influenza virus. And a study of high touchpoint stair handrails found norovirus on up to 22% of these surfaces. So with their shared objects, close contact, and young occupants, schools represent places where the risk of fomite transfer is actually higher than at other types of facilities. So another everyday action in the layered approach to infection prevention in schools is routine cleaning, sanitizing, and disinfecting. They are one way to help break the chain of infection so everyone stays healthy. Now, we know that microorganisms are on many surfaces, and surfaces need to be cleaned regularly. And sometimes surfaces need to be sanitized or disinfected too. There are 3 main levels of microorganism control in schools. The first is cleaning, which physically removes visible dirt, organic matter, viruses, fungi, and bacteria, but it doesn't kill them. What it does is it actually transfers whatever was on that surface you were cleaning to whatever you were using to clean. Now, general surface cleaning is done with water, detergent, and physical scrubbing of that surface. It's that physical scrubbing that does the work to remove microbes rather than kill them. Next is sanitizing. And sanitizing is a process used to reduce, but not necessarily eliminate microorganisms from surfaces. Sanitizers don't have claims for viruses or fungi, and sanitizers are often used for surfaces and objects that come into contact with food. The third method is disinfection. Disinfection is a process that kills or irreversibly inactivates microbes on a non-porous surface, but does not necessarily kill their spores. Disinfectants are actually registered by the EPA as pesticides, and they're used to destroy or suppress the growth of harmful microorganisms on surfaces. The product label identifies which microbes the disinfectant has been tested to kill or inactivate. And different ingredients or a combination of ingredients kill different microbes. So a disinfectant must be selected that works on the specific microbes intended to be killed, or you could use a broad spectrum product that works on all the microbes that might be encountered. And remember that some bacteria and fungi have spores. Disinfectants may not necessarily kill these spores, so you'll need to use a product that's listed on the EPA approved sporicidal agent list. So as in healthcare, the most important places to clean and disinfect are frequently touched surfaces, particularly during the flu season or a virus outbreak. Ideally, frequently touched surfaces should be cleaned and disinfected daily. In common high touch or frequently touched surfaces in schools are surfaces that are touched by many different hands, and these should be managed for infection control. And there are also common high-risk areas in schools. These are areas that are more concerning for possible transmission of disease because there is the increased likelihood of skin-to-skin, object-to-mouth, or fecal-oral contact. Also considered high risk are the areas where food is prepared, sick or preschool children are cared for, or special events or incidents like blood or body fluid spills occur. So implementing surface cleaning strategies enhances safety, reducing the risk of infectious disease transmission. Surface disinfection is a powerful strategy to eliminate microbes on surfaces. A study examining the effectiveness of surface cleaning in elementary schools found that students in classrooms that were disinfected daily were less likely to report absenteeism due to illness compared to classrooms without that daily surface disinfection. But unlike use in healthcare, disinfectants are not recommended for daily use in schools other than on those high-risk surfaces and areas and where required by regulation. Situations that do require disinfection include accidents involving blood and body fluid, vomit, feces, some bathroom surfaces, and for specific legally required activities in food preparation areas and in childcare settings. Now, there may be a single incident or situation with higher health risks, where it might be important to clean and disinfect surfaces more frequently. And these include when there's high transmission rates of infectious diseases like cold, flu, and GI illnesses, and when hand hygiene is absent, infrequent, or improperly practiced, many of which are common in schools. Rarely, a school might need specialized or enhanced cleaning and disinfection for a particular infectious disease. And this can occur when a new pathogen emerges, like COVID-19, or when an ill student has been in the school space, or an outbreak occurs with a specific pathogen, say like norovirus. Schools should consult with their state or local health departments to determine what cleaning and disinfection is needed in these specific situations. There are many cleaning and disinfection products available, and not all products are equal. They have differences in efficacy, compatibility, and application. It's a lot to figure out. This makes selecting the right products for the job essential for successful school cleaning and disinfection. You have to know which products you need for a particular surface or task, how to use them correctly and safely, how to store them safely. When possible, you should try and minimize the number of different cleaning products. You should read the product label, follow instructions carefully, check the label for recommendations on PPE to use, and be sure to use that PPE. Prepare those products in a space with good ventilation because some products have strong smells or fumes, and use scent-free products whenever possible. Make sure there's no kids or other unauthorized people in the room when preparing or using these products. Exposure to cleaning and disinfecting products can be dangerous to children and people not trained to handle the products. Don't mix chemicals. Bleach should only be mixed with water. Make sure the correct labels stay on bottles and label any new bottles properly. Clean up and dispose of any materials properly, like PPE, cleaning cloths, etc. Lock up all cleaning supplies after you're done and wash your hands. It's important to ensure that the right products are being paired with the right spaces. Consider performing an assessment of your school to understand where the risks are and which spaces will need the most attention. This can become part of your cleaning plan. But no matter what space you're cleaning and disinfecting, having the right products will provide a more efficient and effective process. Now, a cleaning plan provides the basis for cleaning and maintenance tasks. It describes how often and how long to perform these tasks. It has special instructions on how to clean, sanitize, and disinfect particular items. Some key topics you should include in your cleaning plan are listed on this slide. Now, who creates a cleaning plan? Well, often it's the administrator that takes the lead. Administrative staff can help, and others should be involved or can be involved. But all staff should know and follow that cleaning plan. With a cleaning plan, everyone knows what's required, and each person follows the same steps. Please be sure to discuss the cleaning plan in staff meetings and trainings, and make that plan easy to follow. Ensure all staff have enough support and supplies to carry out the plan, especially teachers, because they are the #1 cleaners of their spaces. The link at the bottom of the slide will take you to sample cleaning plans. This cleaning schedule lists tasks. It shows how often to do them. And there's also a timeline for cleaning that has all that happens in a day. It shows cleaning and non-cleaning activities. Staff members do activities at different times, so timelines might help staff organize their time. It's really hard to make a timeline for everyone, so give staff a template and they can tailor it to their daily needs. The links to these examples are also in the resources slide at the end of the presentation. Now, as students return to classrooms after winter breaks, bringing their microbes with them, it's a good time to refresh hand hygiene. A recent study by the Global Health Council showed that globally, almost half of 5 to 10-year-olds, 42%, are not always washing their hands with soap at school. Now, this is not funny, since hand washing with soap and water is one of the best ways to reduce germs that may cause illness. We all know that K through 12 schools are especially germy settings, and parents and teachers everywhere have daily battles with kids to not only wash their hands correctly, but even to do it at all, especially when it matters most, like after using the restroom, before eating, and after coughing or sneezing. Students don't always have the best hand hygiene practices, so this contributes to the spread of organisms in schools through direct and indirect contact. Some kids might not wash and dry their hands correctly after they use the bathroom. This is especially true for younger kids, but it also applies to older kids if they lack good hand hygiene. This is how they can spread organisms from their hands to teachers and other kids and frequently touched items. Playing with, feeding, or cleaning up after a classroom pet is another way organisms can spread. Organisms from that animal's body, their food, or their poop can get onto hands and spread to other children and staff and can transfer to frequently touched items. Hands are what make organisms mobile. People touch their faces all the time and they don't even realize it. When you touch your face with unclean hands, microorganisms can enter the body through your mucous membranes, your eyes, nose, and mouth, and make you sick. Another way organisms can spread is hands touching objects like handrails, tabletops, desktops, or toys and books. That's indirect contact through fomites. When someone touches these objects with unclean hands, organisms can transfer to the object. When another person touches those objects, they can get those organisms on their hands. Microorganisms Microorganisms can also get into food and drink when people prepare or eat food with unclean hands. That's indirect contact through fomites. Everyone who works in schools benefits from clean hands. Another everyday action in the layered approach to infection prevention in schools is hand hygiene. Hand hygiene is a method to clean hands that substantially reduces potential pathogens. In the United States, only about 79% of the total population washes their hands regularly. Most people wash their hands for about 6 seconds. 20% of people dry their hands after washing them, but damp hands are 1,000 times more likely to spread bacteria than dry hands. And up to 80% of communicable diseases are transferred by touch. In a study published by the American Society of Microbiology, 50% of middle and high school students reported washing their hands. You're thinking, yay, but only 33% of female students and 8% of male students reported using soap. These are some reasons why promoting proper hand hygiene in schools is an essential part of an infection control program. Now, there's two methods of hand hygiene used in schools, and one is hand washing. And that's washing hands with plain soap and water using a rubbing motion or friction to help remove debris. The soap emulsifies and suspends the soil and microorganisms so they can be simply rinsed away. It doesn't necessarily kill microorganisms, but it removes them. That's why hand washing is called the mechanical removal of microorganisms. The CDC recommends hand washing to effectively prevent transmissions of infection in schools. Best practice is to vigorously wash hands with liquid soap and water for that 15 to 20 seconds or the time it takes to sing the ABC or the birthday song. Any amount of hand washing is beneficial, but the longer time is optimum. Now, the second method is using an alcohol-based hand rub or hand sanitizer, rubbing hands with a 60 to 90% alcohol-containing preparation. Now, understand that the disinfecting power of alcohol drops at concentrations higher than 95%. 70% is actually the sweet spot because it has more water, which helps it dissolve more slowly, penetrate cells, kill bacteria, and evaporate more slowly. Alcohol-based hand rub is used when hands aren't visibly soiled because they aren't effective if organic matter is visible on hands. A study in the Journal of School Nursing found that students using alcohol-based hand rub or washing their hands reduced absenteeism due to infectious disease by 43%. To create a culture of clean hands in your school, make a hand hygiene plan if you don't already have one in place. Plan is a detailed set of actions to improve the cleanliness of hands throughout the day in your school setting. It helps identify who, when, where, and how to perform effective hand hygiene. And it's often part of a larger facility cleaning plan, or it can simply stand alone. Some hand hygiene plans are put together by larger school districts or state office, facility administrators, or individual staff members. Hand hygiene plans vary because one size does not fit all. And you can see some of the things to consider in your hand hygiene plan. So some of the barriers to hand hygiene could be lack of consistent hand drying or soap supplies. So make sure to include supplies in your school budget and task someone with tracking these supplies. Make sure there's someone that keeps all the supplies stocked and monitor and check supplies during and after high traffic times. And ask parents, along with that list of school supplies, to send additional supplies like soap, paper towels, and hand sanitizer. If there's lack of infrastructure, make sure there's sinks at key locations, you have clean running water, there's soap, and something to dry hands with. You can also add portable hand washing stations in key areas. If there's lack of time, combine hand washing times for staff and children and schedule hand sanitizer use during transitions, like waiting in lines. If supervision of compliance is an issue, Put visual reminders like signs or posters for kids and staff in bathrooms or kitchens, and place hand sanitizer in supervised settings like the school cafeteria. If there's competing priorities, merge hand washing time with other activities. An example that was given is while some kids wash their hands, quiz other kids on recently covered topics. If it's not a habit, build cleaning hands into your daily routine. Ask everyone to use hand sanitizer when entering your school or classroom. And if it's not taught at home, provide regular hand hygiene instruction in school or your classroom and be a role model. Clean your hands in front of staff and children. Teach parents and guardians how to clean hands. Share why it's important so hand hygiene is encouraged at home. Send home flyers or add messages to social media posts or your school newsletter. If kids refuse to do this, make sure you have age-appropriate answers for why clean hands are important, and try and engage parents and guardians so clean hands are supported at home. Be a role model and figure out a way to make it fun. Refusal by staff, you can have open talks during staff meetings about challenges. Talk regularly why hand hygiene is important, and make sure that staff understand that hand hygiene also keeps them and their families healthy too. Put reminders in break rooms, restrooms, and near hand sanitizer dispensers. Washing hands in schools can help prevent the spread of respiratory and GI diseases, and there are many strategies that can be tried to increase success. Make it fun. So many diseases are spread through airborne particles or droplets that get in the air when people cough, like I just did, sneeze, blow their nose, or spit. One way to minimize the spread of these diseases is by practicing good respiratory hygiene and cough etiquette, which are another everyday action in the layered approach to infection prevention in schools to decrease the transmission of respiratory illnesses. Because some people cough without having respiratory infections, we don't always know who's infectious and who's not. So respiratory hygiene and cough etiquette are really important components to protecting yourself from illness and preventing others from becoming ill. Many people cough or sneeze into their hands to stop germ spreading. This is not the best practice because you can transmit the microorganisms by touching things or shaking the hands of other people. The best thing to do is to avoid coughing or sneezing in your hand. But if you must use your hands, wash your hands with soap and water as soon as possible before you touch anything else. The correct way to cough or sneeze without transmitting germs is to use a disposable tissue, a handkerchief, or your sleeve. When you cough or sneeze into these, you're really less likely to spread germs. If you do use a tissue, dispose of it immediately. And if you use a handkerchief, those things still need to be washed frequently. Always wash your hands as soon as possible if you use either of those. Covering coughs and sneezes and keeping hands clean can help prevent the spread of serious respiratory illnesses like influenza, RSV, pertussis, and COVID-19. One other thing, to help prevent the spread of respiratory disease, you should avoid close contact with people who are sick. Now, vaccination is another everyday action in the layered approach to infection prevention in schools that can prevent common diseases that used to seriously harm or even kill infants, children, and adults. Without vaccines, children are at risk of becoming seriously ill or even dying from childhood diseases such as measles and whooping cough. Children are exposed to thousands of microbes every day through the food they eat, the air they breathe, and the things they put in their mouths. Vaccines use very small amounts of antigens to help their immune system to recognize and learn to fight serious diseases. And antigens are part of a microbe that causes the body's immune system to get to work. Different vaccines work in different ways, but every vaccine helps the body's immune system learn how to fight microbes. Now, it typically takes a few weeks for protection to develop, but that protection can last a lifetime. And sure, there's a few vaccines, such as tetanus or seasonal flu, that require occasional booster doses to maintain the body's defenses. Vaccination is an effective, well-established public health strategy. Vaccines provide safe and effective protection against many infectious diseases. Vaccination reduces disease morbidity and mortality. It averts healthcare costs, prevents parents and caregivers from losing wages from having to stay home to care for their sick kid, and it supports student academic achievement because they're still in school learning. Childhood vaccination in the US has been very successful in preventing illness and death. Diseases like diphtheria, mumps, and measles, once common at young ages, were practically unheard of, except now we have sporadic outbreaks occurring. I bet you didn't know that measles was declared eliminated in the United States in 2000. This was thanks to a very high percentage of people receiving the safe and effective measles, mumps, and rubella vaccine. But as of November 21st, 2024, there was a total of 280 measles cases reported in 20 states. The Advisory Committee on Immunization Practices, that's ACIP, the American Academy of Pediatrics, the CDC, the World Health Organization, and other scientific bodies recommend scheduled childhood vaccinations, including vaccination against influenza and COVID-19. All states, the District of Columbia, and territories have vaccination requirements for kids attending school. Schools and health departments can help promote access to routine annual vaccinations for staff, students, and families by providing information about recommended vaccines and promoting their safety and effectiveness. They can offer workplace vaccination programs, providing paid time off to get vaccinated. Make vaccinations available on site by hosting school-located vaccination clinics, or connect students, teachers, staff, and families to those off-site vaccination locations. These are important tools for maintaining high vaccination coverage and low rates of vaccine-preventable diseases. Keeping up to date with recommended vaccines is one of the best things you can do to help protect your child from serious disease. The United States has had more than 1,200 cases of measles in 2019. This was the greatest numbers of cases reported in the US since 1992, and since measles was declared eliminated in 2000. And as I just mentioned, there were 280 cases as of November of 2024. Before entering school, young kids are exposed to vaccine-preventable diseases. Children under age 5 are especially susceptible to diseases because their immune systems haven't built up the necessary defenses to fight infection. Vaccines are recommended throughout our lives to protect against serious disease. Some vaccine-preventable diseases like pertussis and chickenpox remain common in the United States. On the other hand, other disease vaccines prevent are no longer common in this country because of vaccines. Think of polio. But if we stopped vaccinating, the few cases we have in the United States could very quickly become tens or hundreds of thousands of cases. Even though many serious vaccine-preventable diseases are uncommon here in the United States, some are very common in other parts of the world. We are a global society. Even if your family doesn't travel internationally, you could still come in contact with international travelers anywhere in your community that might cause a serious vaccine-preventable illness. Kids who don't receive all vaccinations and are exposed to a disease can become seriously sick or worse, and can spread it through the community. It's always better to prevent a disease than to treat one after it occurs. Vaccination saves lives. So schools have a really critical role in preventing infectious disease and ensuring the health and safety of students, staff, and the wider community. Developing a science-informed plan is the first step in playing this critical role. Everyday actions and the layered approach to school infection prevention gives the most protection against infectious illness. Respiratory diseases easily spread from coughs and sneezes. Well-ventilated rooms help reduce the number of airborne microorganisms inside. Evaluate your HVAC systems for efficiency, increase airflow, open your windows if you can, hold some activities outside. Target cleaning and disinfection of common high-touch or frequently touched surfaces and common high-risk areas in schools for infection control management. Follow a good cleaning schedule and sanitize or disinfect appropriately. Increase the frequency of cleaning and disinfection, of course, during illness outbreaks, when there's a known contamination, when there's visible soil, blood, or body fluids, or when it's recommended by the local health department. And teach everyone good hand hygiene at key moments, such as after using the toilet, when arriving at school, or before eating. Hand washing is the single most important way to prevent the spread of communicable diseases. CDC recommends soap and water hand hygiene for schools. School health personnel should perform hand hygiene too, before and after working with a student, including medication administration or treatments, immediately after touching blood, body fluids, non-attacked skin, mucous membranes, or contaminated items, even when gloves are worn during that contact. Also, immediately after removing gloves, after touching objects or using equipment in that health office. Respiratory hygiene, cough etiquette can help stop the spread of microbes. Cover your mouth and nose with a tissue when you cough or sneeze. Throw those used tissues in the trash. If you don't have a tissue, cough or sneeze into your elbow, not your hands. And remember to immediately wash your hands after blowing your nose, coughing, or sneezing. Vaccination is a proven public health intervention. Schools can support vaccination uptake by supporting school-located vaccination efforts, as well as tailored education interventions for parents and family. Require that children are up to date on immunizations, and when parents have questions or concern, provide them with science-based educational materials available on the CDC and the Immunization Action Coalition websites. Some other important things to remember: collaboration between school staff, parents, and local health department is essential to effective infection control. Policies and procedures for infection prevention and control should be clearly written, and staff should be trained regularly on proper hygiene practices and infection prevention protocols, especially if something changes. These everyday actions can help decrease infectious disease transmission and prevent a wide array of illnesses caused by both bacteria and viruses. There's no single slice that's 100% effective at preventing disease. That's why it's important to have many slices of cheese or interventions for reducing your risk. With the right products and procedures in place, schools can prepare themselves effectively and efficiently, and they can help drive confidence among parents on the wellness of their children throughout the school year. Thank you.